Now, I've had a gut issue for a long time, and the classic entry point into the system is you go to a doctor and they'll say, let's do a poo test. Are these tests accurate?
There is nothing that I think that one can do today to look at a poop sample and say, right, you've got this or you've got that, unless you're looking for something like blastocystis, parasites or this kind of thing, an overgrowth of this kind of thing. Let's say that there's nothing like that, and that we will take a poop sample, and we'll now have a look at what kinds of bacteria that are there, and now we're going to diagnose something. I don't think there's anything like that today.
Even though they're being sold?
Even though they're being sold, I don't think there's anything like that that is clinically 100% relevant. It may have some relevance, but we're all different. I think that doctors need to be allowed to do the job that they do by diagnosing and saying, well, do you have any abdominal pain? Do you have excessive gas? What is it that you eat? One of the questions that I teach doctors is, you don't ask people, do you have breakfast, but what do you have for breakfast? Okay, these kind of inquiries can actually give doctors a lot of clues about how people are going with their digestive tract. Okay, and whether they do any physical activity. But one of the most important things is, as I said before, is talking about people about what stresses them. No one seems to talk about this. That's part of everyday life, and stresses, do affect gastrointestinal health. A lot of people that become very nervous when they go to an interview, or they've got to do something in a group of people, become very, very nervous. Some people become constipated. Others get diarrhea. That sort of thing that happens when people become very, very nervous or very, very stressed. So, stresses. What are you eating? Are you exercising? What drugs are you taking? Are you taking any medications of some sort or another? Analgesic medications do affect the gastrointestinal microbiome. So do antibiotics, as I've said. So, all of these things, one needs to discuss these things with patients. But as I always say, there are no miracles. What happens is that if one puts a program for a patient together, because they're individualized programs, it needs 70% needs to happen on the other side of the table. So if one is a willing participant, you get the result. But if people are not willing participants, there are no miracles. And that's what the so-called integrative medicine doctors do today. They talk to people about everything, all right? They don't say, don't do this, don't do that. They talk to them about everything and what fits in their lifestyles. Are you married? Are you not married? Do you have kids? You don't have kids? Do you have a job? You don't have a job? Do you have one job? Do you have two jobs? All of these kind of things, all right? And then, with all of that, taking a family history of, is there any history of cardiovascular disease in your family? Is there any history of type 2 diabetes? Any history of dementia? All of these kind of things. That builds a picture. And this takes time. Integrative clinicians or clinicians, GPs that do this kind of a job, you can't do this in 5 minutes. This requires a half an hour, 45-minute consultation first up with a brand new patient. And then putting a program in place for that particular individual, depending on what it is that's going on in their lives.
Well, I've got chronic inflammation in my system. Is that normal? Is inflammation natural part of aging?
Everybody's inflamed.
Yeah.
But it's a controlled inflammation, okay? Like, for example, we live in a state of homeostasis, in other words, a balance, all right? If your blood pressure's too high, you're dead. If your blood pressure's too low, you're dead. If your temperature's too high, you're dead. If it's too low, you're dead. You see, this is balance. Inflammation is a requisite. When you cut your finger, that particular part of the finger becomes inflamed, right? Okay? It's repairing itself. So controlled inflammation is a good thing, okay? It's inflammation that's out of control. Like, for example, you would find in people with Crohn's disease, or people with ulcerative colitis, or people that have got a mixed inflammation of the gastrointestinal, of the intestines. Okay, inflammation that is out of the range, yes, that's a problem. Okay, and people can become inflamed and continue to become inflamed as they age. They call it inflammaging. All right, and yes, it can happen as the system breaks down and as the system ages and you're losing tissue, and let's say that you're losing a certain percentage of a particular organ and it's trying to maintain its function. Yeah, okay, it's a normal process of becoming inflamed. Are there things that we can do to, restore the balance? Are there things that we can do? Yeah, I think that there are.
So do you treat it or do you look for the cause?
You do both. You look for the cause and then you try and tailor a treatment for it.
So you look at the gut first?
Yeah.
How do you look at the gut?
The symptomatology, the symptoms that patients come with.
Okay, so you have diarrhea, you have constipation, or you have some disruption of normal patterns. Then what do you do?
Well, it depends what it is. If it's diarrhea, you need to get down to the cause of what is it. Okay.
So then doctors
if it's constipation,
doctors then will go and they'll do a poo test. So there's no parasite or there's no bacteria, or then what do you do? They call it irritable bowel.
Well, it can be irritable bowel. It can be but irritable bowel doesn't just come. It's irritable bowel due to diarrhea, irritable bowel due to constipation, irritable bowel that's a bit of both. Which irritable bowel? Most times people have got an irritable bowel because they are stressed in their lives. If one really talks to someone, you really get down to it. It's to do with work, it's to do with family, it's to do with things that are, that are going on in their lives that doesn't allow them to make prudent nutritional choices. They might go without a meal and they're supposed to. They might go they may have hydration problems, that they're not drinking enough water. And this is not a plug to drink 5 litres of water a day. This is not that. But actually, when you need water. Okay, half a litre to a litre and a half per day in the elderly is very critical. The elderly, most of the times, an institutionalised elderly, they're dehydrated. They're left on the corner. It's like a plant, and they don't get watered. All right, so one really needs to look at what is really going on. And often that's very, very tough to extract this stuff from people that you've just met.
But does irritable bowel, would that lead to inflammation markers?
Irritable bowel is an inflammatory problem.
Okay, it is.
So does it lead to an inflammatory marker in the bloodstream? Yes and no.
Okay, so what if you've got inflammatory markers that have been tested now for inflammation?
Well, we know that interleukin 13, 6 are inflammatory markers, and interleukin 10 is an anti-inflammatory marker. Okay, they both exist at the one time. Bit of inflammation, a bit of like this. Okay, a little bit of both, because that's the norm. That's the normality. That's the normality.
So if you've got high,
it's when the pro-inflammation just continues and continues.
Yeah.
Not that it's high; it's just continued. All right, continues and continues. Pro-inflammation continues. That doesn't have a chance to recover or to reset itself.
Yeah.
Okay, that's when it's a problem.
Yeah.
Okay, and you see these kind of things happening in type 2 diabetics. You see this kind of thing in chronic kidney disease, in rheumatoid arthritis, osteoarthritis. They're pro-inflamed.
Yeah.
Okay, osteoarthritis of the knee, let's say, for an example, because we've done research in that area. They've got pain in the knee, so flexibility's decreased, mobility's decreased, pain's increased. Okay, so what do? Well, there are studies that show that if you give someone prebiotics or probiotics, things like that, that you're affecting the gut, the inflammation in the gut, because most of these people are dysbiotic because they're always taking analgesic medications. There's no cure for osteoarthritis. Okay, so you're taking the anti-inflammatories to help with the pain. All right, okay, that's shifting the microbiome in the intestine to a pro-inflammatory microbiome. Okay. And so what probiotics and prebiotics tend to do is recover that pro-inflammatory dysbiotic effect that then translates to a better functionality on the knee, reduced pain, better mobility, better flexibility. And that is because I think that the gut controls functionality of end organs, whether it be the kidneys, the joints, the muscle, the liver, the brain, because there's a gut-brain mood connection, very, very significant, that if one can actually address pro-inflammatory activity that's out of the norm in the gut, you might well, not fix everything, but might be influencing in a positive way an end organ that's out of whack.
Right. Would someone like me, who's got this myriad of inflammatory stuff going on, would they benefit from having a fecal transplant? Would that reboot?
I don't know.
Yeah.
There's an idea that it would reboot your gut. There is an idea for that. Where fecal microbial transplants have been very, very good with a 97% success rate has been for Clostridia difficile infections, and nosocomial infections. And Tom Barodi here in Sydney, he's been doing this kind of research since the late 80s. All right. I don't think that they will fix everything. The question that I have from a research point of view is that we've been doing this for so long and still how come we don't have a pill yet? There was a recent study from a company overseas that had a pill, I'm pretty sure it was a pill, with about 9,000 bacteria in it, which was from a poop sample.
Is it the crapsule?
No, I don't think it is, but you could probably, but it's not that. And the company's lost 75% of its share value because the clinical trial didn't work. And I'm always mindful of these kind of results because I don't believe that if you take a poop sample from someone and you then transfer it to another person that you're going to fix everything. All right. Now it's really good for Clostridium difficile diarrhea or infections. Because it tends to actually rebalance the gut in that particular respect. Because Clostridia, this particular Clostridia difficile, the bacterium, is a pathogen, and its overgrowth is pretty serious stuff. It can actually take your life. All right, but there are other things in the intestinal microbiome like bacteriophages. These are viruses that parasitize and or kill commensal as well as pathogenic bacteria. And we're only just starting to find out what these are all about. Because when you look at these viruses, they don't infect the human cells. They only infect the bacteria. That's why they're called bacteriophages. All right. However, the stunning point is that there are more viruses than bacteria and human cells put together. So these chemicals that infect bacteria specifically may have a very important part to play in health because they may be inserting their DNA or RNA, depending on what it is, mostly DNA, into the bacteria, which then tells the bacteria what to do. And then it produces a metabolite that then the human can use to its advantage, or other metabolites that are disadvantageous for the human. So that's something else that we really need to look at.
Tell me about prebiotics.
Well, prebiotics are things like inulin, a food for the intestinal microbiome. Okay, or resistant starch. The bacteria utilize them to produce energy, and as a consequence of that, produce things such as short-chain fatty acids like butyrate, which is used by the human host as an advantageous molecule to decreasing inflammatory activity.
Right. So is inulin the same as resistant starch?
No, it's not. They're different.
So what's
well, it's how they're produced. All right. Just think of it.
Do you take both, or do you take one or the other?
No, you take one or the other. I mean, if you take inulin, there are the galacto-oligosaccharides is another one. They're all basically from plant products. Okay, that are manipulated in a particular way that then gives you a product. Because people are selling product, and you want to be different from, so you do different things. Okay, resistant starch. There's a lot of evidence associated with resistant starch that can actually do a lot of benefit to human health in the gut.
Yeah.
Especially by producing bucket loads of butyrate.
So how often do you have to take resistant starch? Is it once a day or?
Depends what it is. Depends what
Right.
it is. If you're consuming your vegetables and fruit daily, you're okay.
But not if you've got an
But
imbalanced gut.
then you need to assess what it is.
Yeah.
It's not a one shoe fits everybody. Okay.
But this-
You need to see what the
The
patient's
big
about.
issue is, Lewis, is that you go to a GP or an integrative or
Yeah.
whatever, they've all got a view. There's not
Yeah,
one
no.
protocol where they
Yeah.
say to the patient, okay, we start with this, we'll test, we can see this. Then when we see this, we do that. When you see X, something different, you do that. There is no one. So it's like the Wild West.
No, it's not like the Wild West. What it is
From a
is
patient
that,
perspective, it is. Unless you're going to this,
we don't, because we don't have the research data that we may have with things such as a cholesterol-lowering drug.
What are these functional foods that have prebiotic activities?
Functional foods are good, especially things such as kefir. Kefir is probably it's awful taste, but it's a very nice functional food for the intestinal microbiome. Very nice. So are good yogurts. Watch it because a lot of them have got sugars in them. They make them palatable so that everybody can eat them, particularly kids. Kombucha tea, it's full of compounds that are, again, fermented compounds and molecules that the gut microbiome loves to use and are advantageous for health. Yeah. So all these things are good. You just got to watch what it is that you're picking. Kefir is not for everybody. And then you've got things like yogurts from Parmalat and yogurts from Yoplait and all of these. They've got sugar in them. They've got fruits in them. You've got to really read the label and see which one is good for you. All right. And then you've got your Cult that targets everyone with the little bottles. With the special probiotic strain in there. It'd be nice to know if that strain's alive or not. I'm sure, that starts off being alive. I just don't know how long it lasts in that little bottle alive. Okay, so you really got to watch it. Okay, you can go to a supermarket or a health food store and talk to them about which are the good ones and read. Really look at the label and see what it's got in it. And if you don't understand something, ask. Don't just take.
Thank you for your time, Lewis.